series of indications over the last few days, and now I must just say in the last hour or so, that there could be big changes coming in the National Health Department. The indications are that the Director General, Dr. Sandile Buthelezi, may in fact have been suspended. Again, the suggestion that Dr. Nicholas Crisp has been appointed as the new acting Director General in the Health Department. Now, yesterday the Special Investigating Unit confirmed it believed the former Health Minister, Dr. Zweli Mkhize, may have been guilty of criminal acts for his decisions during the Digital Vibes scandal. Fatima Hassan is at the Health Justice Initiative. Fatima, good afternoon to you. Look, we're awaiting a statement from government on this. There's been informed reporting, let me call it that, predicting that all of this would happen for the last several days. What does it tell us about what's happening in the Health Department if we're about to get an acting Director General?
Thanks, Stephen. So the information that we have is, as you've indicated, that a new acting DG of Health has been appointed and that the person who will be taking up that position will be acting in place of Dr. Buthelezi is actually the person who's in charge of the National Vaccine Rollout Program and was also tasked with implementing national health insurance, Dr. Nicholas Crisp. So if that information is correct, and we believe that it is and that it's reliable, it means that it's a department that is doing two things. In the middle of a pandemic, is losing a lot of key personnel and institutional memory because it's occupied with dealing with quite a significant corruption scandal which is hanging over the department. And secondly, it means that the person who's meant to be in charge of the National Vaccine Rollout Program is now going to be taking up additional responsibilities and tasks. So we're really hoping that the minister will have an urgent press conference and take, questions from journalists and from the public and civil society to understand what all of this means. I mean, I think you've accurately sort of indicated that in our view, this is actually just symbolic. This is a department in the middle of a pandemic that has now lost a minister, that has had an acting minister, that has, had a new minister and a deputy minister installed, and now has a DG who's been suspended as well, all because of the Digital Vibe scandal.
Well, I mean, there's so many aspects to this. I mean, I would suggest there is nothing more important for our society to do quickly and to do well than the vaccine rollout program. There's one person in charge of that. Now he has a national department to run, from what we understand. I mean, it would seem intolerable. I mean, I would think you would want to put all of society's resources into the health department at the moment.
Definitely. Or, alternatively, what other countries and jurisdictions have done is actually appoint a COVID minister for the duration of the pandemic, or appoint a vaccine minister or a vaccine czar for the duration of the pandemic, which could be located in the presidency. I mean, earlier you indicated that the disaster has been extended up until October. That's also an untenable situation. So I think we're really at a crisis point in terms of our response to this pandemic and the way in which the health department is hemorrhaging in relation not just to digital bias, but in relation to a whole number of other factors, I think is quite concerning and quite worrying. The fact that we've had a new minister now installed and an acting DG, I think tells us that, we have a lot to be concerned about. We hope that there will be an urgent summit of all relevant stakeholders so that we can provide those very resources that you are talking about, Stephen.
I would imagine, and I hate to say this, but the Digital Vibe scandal I don't think is over yet. That would certainly be my view on it. What I mean is there could be other officials who could be suspended as well. In other words, the scandal isn't done. There could be other capacity in the department about to leave or about to be suspended.
Definitely. We're hearing reports of additional potential suspensions, and we're also hearing unconfirmed reports of resignations of people who just do not want to work in such an intolerable environment. So I think the bigger issue that we have facing us as a country is that we have a health department that, has to deal with this pandemic, but is also tasked with the responsibility of implementing universal health coverage in our country. And I mean, we all know about the issues around health inequity in our country. So it really is, I think, a crisis point for the ruling party and I think for government and, not just the Minister of Health who has to brief us and take us into his confidence, but I think the President too.
I do understand, and there was an indication earlier on one of the WhatsApp groups that I'm on, that there might well be another health briefing tomorrow morning at 8 o'clock. Traditionally, over the last month or so, they've been at 7:30. I'll wait to see if that's maybe moved up, because I agree with you, if I may say. I think there is an urgent need to answer questions. The next question that would come, Fatima, is, Do we, as a country, have the right people that we need that could be moved into the national departments? And I imagine the first place you would look, if you're looking for people who can manage a health department, who can help at this moment, would be the provinces. And some officials, I'm thinking maybe in the Western Cape, there'll be other provinces, other examples. These will be people with a lot of experience who maybe are the people we need, who need to be seconded perhaps to national.
Yeah, I mean, I can talk about, just my brief experience of having worked actually with Dr. Nicholas Crisp in the National Department of Health many years ago under former Minister Barbara Hogan. And I think what we realized was two things. One is that we need to deal with the issue of obviously cadre deployment and job reservation. And I think the Department of Health has been bedeviled by the issue of human resources and adequate human resourcing and the right people for the right positions. And I think the digital vibe scandal has basically, blown all of that up into the public's eye. But certainly, I think you're right. There's really solid people who are very honest civil servants who are working in multiple health departments across different provinces, including even in Limpopo, for example, who's run a really successful vaccination rollout program. And those people could be seconded to the National Department of Health. There are people in civil society. There are people in business. So I think that, if there is a commitment to look for people with the right skills and with the right energy and with the right sort of commitment to not unduly profit off a pandemic or any other health intervention, then you may find the right team for the department. I mean, it's a bit incredulous if you look at some of the people who've been in the department for over 20 years, including people who were part of the HIV/AIDS denialist era. Of the South African government. So certainly, it may be an opportunity for the new minister to really change the people he surrounds himself with and to get the right people in.
Within all of this, I mean, we should stop for a moment perhaps and just look at the damage the digital vibe scandal is doing at this time, and what the root of it was, which was that the health minister then, Dr. William Kize, as the SIU put it yesterday, signed off on 2 budget allocations that came to 150 million rand for the company Digital Vibes, which was run by his former personal assistant, Dihya Ramata. It's not my job, and it's certainly not my place to make moral judgments, but in the end, the inescapable conclusion is that this is about greed, and this is the damage that greed may have caused.
Yeah, I mean, I agree with you. No patience and no mercy for anybody who profits off a pandemic. You're profiteering off the vaccine rollout, you're profiteering off PPE, you're profiteering off information tenders, then I think the full, might of the law has to apply to all of those people who are implicated. Obviously, there needs to be due process, and we believe that that's part of the process that is currently unfolding, that people are now facing disciplinary hearings. So we look forward to the resolution of those disciplinaries, and hopefully more information will come to light, because, you're right, it's not just digital vibes. We believe that there's a lot more that many people are going to still have to account for.
Fatima Hassan, I really appreciate the time. Thank you very much indeed from the Health Justice Initiative.